Cold open. I was making soup the other night, a simple ginger lemon broth. Thought I'd nailed it, and then the first spoonful hit, and it tasted like cardboard with a weird metallic twist. I stopped mid-stir, sat on the counter, and felt this odd mix of grief and disbelief. That little moment is what pushed me to try smell training. I want to tell you about that, because if you've had something like this, you're not alone. Today, we're walking through a kitchen-first, clinician-backed 2-week plan you can start safely at home.
Welcome to Earthy Remedy. I'm Fiona. We're joined by Somnang, who you just heard, and 2 guests who will guide us. Dr. Maya Iqbal, an ENT and olfactory therapist, and Lena Morales, a culinary herbalist who designs sensory recipes. We'll promise you a clear, safe 2-week micro-trial, aroma jars, a mindful savoring soup to cook along, and short sensory drills. Plus, the exact red flag language you can bring to your clinician.
Quick note before we begin. We'll keep everything culinary and low dose. No undiluted essential oils, no medical claims that replace care. If anything here feels risky for you, pause and check with your doctor. Okay, let's meet our guests.
Hello, everyone. I'm Maya. I work with patients experiencing smell and taste changes, anosmia, hyposmia, parosmia, phantosmia, and I also run guided olfactory rehab sessions. I'm glad we're framing this around low-burden, evidence-based steps you can try safely at home.
Hi, I'm Lena. I blend kitchen practice with gentle herbalism, how to use everyday ingredients to give your senses varied, safe signals. I'll show you aroma jar recipes and a savoring soup that's designed to emphasize salty, sweet, sour, bitter, and umami in gentle layers.
Great! Let's start with the basics. What's actually happening when smell and taste shift after an illness, and what should listeners realistically expect? Dr. Maya, over to you.
Smell loss can come from damage or inflammation at the level of the nose and olfactory epithelium, or from neural changes higher up. Parosmia, distorted smells, often appears during recovery when some pathways start reconnecting, but signals are mismatched. Timelines vary widely. Many people see partial recovery in weeks to months. For others, it takes longer. Most importantly, some improvement is common, but complete restoration isn't guaranteed for everyone. That's why measured, safe retraining is useful. It supports the brain in relearning associations without causing harm.
That matches what I felt. Hopeful progress with scary setbacks. Dr. Maya, what are the urgent red flags listeners need to know so they don't delay care?
Sudden smell loss accompanied by new neurological symptoms like weakness, vision changes, or severe headache needs immediate evaluation. Also escalate if you have rapid weight loss, persistent inability to eat, trouble swallowing, or smell-taste distortion that causes years of avoidance and weight or nutritional decline. If you're unsure, forward your tracker notes to your primary care or ENT and ask for an urgent review.
Let me add, from a nutritional perspective, weight loss or marked avoidance is a clinical sign. Tracking small objective checks, like whether you can detect a citrus scent, helps clinicians see change. That's why our micro-trial includes simple daily logs you can share.
Before we get hands-on, a quick prep checklist. I'll read this slowly so you can gather items. Small glass or plastic jars with lids. Cotton pads or cotton balls. A kettle or pot to warm water. A small pot for the soup. Measuring spoons. A notebook or our printable 14-day tracker, and a timer or phone you can set for short sniff sessions. Got those? Great.
Perfect. Now, let's talk evidence and the principle behind smell training. The core idea is simple. Repeat short, focused exposures to a small set of safe, food-based smells twice a day. This dosing, 2 sessions per day, each with brief 10-second sniffing patterns, gives the olfactory system consistent signals without overwhelming it. For many people, that steady repetition helps the brain re-weight connections and improve detection and pleasantness over weeks. Yes, clinically we recommend 2 sessions a day, each about 1 to 2 minutes total across 4 odor anchors. Use a consistent order, Log intensity and pleasantness, and note any aversive reactions. If strong nausea or aversion occurs, stop for 24 to 48 hours and try a lower stimulation swap. And please, no undiluted essential oils near the face, no inhaling from bottlenecks of concentrated extracts. We stick to culinary, food-grade items and gentle sniffing patterns.
Quick measurement note. For each jar, use a teaspoon of the ingredient on a cotton pad or in a small jar, not a full cup. Low dose, consistent exposure. That way we reduce irritation risk and make home practice accessible.
All right, Demo A, Aroma Jar Kit. I'll walk you through 4 culinary anchors that are easy to source and gentle for most people. Bright citrus, roasted coffee grounds, a mild herb like lemon balm or basil, and a toasted seed or umami note, such as toasted sesame seeds or lightly toasted sunflower seeds. Ingredient amounts: about 1 teaspoon of zest or grounds, or 1 tablespoon of seeds toasted and cooled, each placed on a cotton pad in a small jar with the lid loosely on. Label each jar.
Lena, tell listeners exactly how to do the sniff pattern so they don't overdo it.
Sure. Hold the jar about an inch from your nose. Uncap, inhale gently for 3 seconds, exhale. Wait 2 seconds, repeat 2 more times. That's 1 10-second pattern. Move to the next jar after a 10-second neutral pause. Do 4 jars in order, morning and evening. If you feel a sudden aversion, nausea, gagging, or panic, close the jar, breathe in clean air, and pause training for a day or 2. Patch test first. Touch a tiny bout to be inside of your wrist. If you have a strong allergic skin reaction, don't use that item.
And the low stimulation swaps for parosmia, choose milder versions. Switch from roasted coffee to dry toast crumbs for a faint toasty note. Replace citrus zest with a tiny slice of peeled cucumber to get fresh, watery cues. Use lemon balm rather than crushed garlic or raw onion. The point is to find anchors that are recognizable but not overpowering.
Quick, safe use note. Avoid concentrated menthol or camphor products. Keep jars capped between sessions and store ingredients in a cool place for freshness. If you have asthma or severe allergies, talk to your clinician before starting inhalation practice.
Okay, now the part a lot of you asked for, a cook-along. Lena, lead us into the mindful savoring soup. Tell us why this recipe is built the way it is.
This soup is single-serve, gentle, and layered to highlight 5 basic taste cues without overwhelming: salty, sweet, sour, bitter, and umami. It's designed to pair with sniff sessions, so your nose gets a cue before tasting. Ingredients for 1 serving: 1 cup low-sodium vegetable or chicken stock, 1/4 cup cooked soft grain like rice or small barley, 1 teaspoon grated fresh ginger, 1 teaspoon miso dissolved in a tablespoon of stock for umami, ½ teaspoon raw honey or maple syrup for sweetness, ½ teaspoon freshly squeezed lemon juice for sour, a pinch of finely chopped bitter greens like baby tail or arugula, and a teaspoon toasted sesame seeds or sunflower seeds for texture and to cue the toasted aroma. Equipment: small pot, grater, measuring spoons, mug, and spoon.
Lena, for listeners with low sodium needs, what swaps do you recommend?
Use a very low sodium stock and boost umami gently with a dried mushroom powder. Start with 1/8 teaspoon. For pregnancy or kids, skip raw honey and use maple syrup, and keep ginger mild, about half the amount. If fresh ginger isn't available, 1/4 teaspoon ground ginger works, but add it later so it doesn't become bitter.
Okay, listeners, let's cook along slowly. Step 1. Pour 1 cup of stock into your small pot and set heat to medium. While it warms, grate 1 teaspoon fresh ginger. You should smell that bright, spicy top note. That's your first sensory cue.
Step 2. When the stock comes to a gentle simmer, add the cooked grain and the grated ginger. Lower heat to a gentle simmer for 3 minutes. You'll start to see the surface ripple, and the aroma will open. Notice it, but don't force it. This is about gentle noticing.
Step 3. Dissolve 1 teaspoon miso in a tablespoon of warm stock in a small bowl. Then stir it into the pot off heat so you preserve probiotics and not heat them to death. That miso is your umami backbone.
Step 4. Add ½ teaspoon honey or maple and a squeeze, about half teaspoon, of lemon for sour balance. Stir gently. Step 5. Ladle into your mug. Sprinkle the pinch of bitter greens and the teaspoon of toasted seeds on top. Hold your mug. Breathe the steam. Then sip slowly. Take 3 small sips and note each one. Salty umami first, then sweetness, then sour as it lingers.
Timing tip: pair this soup with an aroma jar session. Do a brief sniffing round just before the first sip. That pairing helps rebuild flavor associations between smell and taste, which is what your brain uses to identify complex flavors.
If a bite tastes distorted or makes you nauseous, pause. Close the jar, set the soup aside, breathe, and try a low stimulation swap, like removing the greens or skipping the ginger on the next attempt. Don't push through a strong aversive reaction. That can set you back.
Storage and serving. Make single servings. Leftover broth can be refrigerated for up to 48 hours. Reheat gently. Best time to practice? Morning and evening aroma sessions, and savoring soup once in the morning pairing and once in the evening pairing over the 2 weeks. Aim for consistency rather than intensity.
Segment 5. Sensory exercises and tracking. We've made a printable 14-day tracker that lists morning and evening jars, a small tasting log, and simple objective checks. Can you detect citrus? Yes, no. Rate intensity, 0 to 10. Rate pleasantness, 0 to 10. Dr. Maya, how do clinicians use that data?
Clinicians look for small, repeatable signals, an increase in detection frequency, higher intensity ratings, or improved pleasantness over 2 to 4 weeks. If a patient notes steady decline or severe aversions, that's a sign to adjust the protocol. Bring exact daily entries, dates, which anchors you used, intensity scores, and any adverse reactions to your appointment. It makes clinical decisions much clearer.
Okay, let's do a short guided flavor identification drill right now so listeners have a template. Fiona, lead us.
We'll do a 3-step drill. Step 1, pick a jar. Citrus is great. Uncap and do a 10-second sniff pattern. Then pause and say out loud, I detect citrus, yes or no. Rate intensity, 0 to 10. Step 2, take a mindful sip of a small spoonful of your soup. Notice salty or umami first. Step 3, note pleasantness, 0 to 10. Repeat with 2 other anchors. Log everything. Say it out loud. This helps anchor the association.
One tip: use neutral cues between steps, like breathing through your mouth or smelling your sleeve, so your senses reset. And if you can, do a short note about memory. Did citrus remind you of a specific fruit or moment? Those associative cues strengthen relearning. Safety, triggers, and when to escalate. I want to read the exact red flag language you can use verbatim at the clinic. I experienced sudden smell loss accompanied by new neurological symptoms, such as weakness, visual changes, or severe headache. This began on date. And this one for nutrition concerns. I am experiencing persistent distortion of smell or taste that has led to unintentional weight loss of X pounds or an inability to eat, despite trying home strategies over X weeks. Use your tracker entries to give dates and numbers.
Maya, you mentioned earlier what to do if training triggers nausea or severe aversion. Can you summarize the stopping rules listeners should follow?
Yes. Immediate pause for 24 to 48 hours after severe nausea, vomiting, or panic. Shift to lower stimulation anchors. Reduce session frequency to once a day if needed. And if aversion persists beyond a week or leads to reduced intake, reach out to your clinician. And again, no concentrated essential oils or inhaling from tightly capped bottles of fragrance. Stick to food-grade ingredients and small amounts.
Segment 7. Here's your micro-trial schedule and realistic pacing. Samnang, can you read the 14-day plan slowly so listeners can follow along and start day 1 today?
Day 1 to day 14. Morning, 1 aroma jar session, 4 anchors, 10-second pattern each. then a small spoonful of the mindful savoring soup within 10 minutes. Midday, optional mindful sip if you feel up to it. Evening, repeat aroma jar session, then another small soup sip. Log intensity and pleasantness for each anchor morning and evening. Week 1 goal, consistency. Do both sessions each day. Week 2 goal, note any small changes and celebrate tiny wins, detecting a faint citrus, a less metallic edge. If anything feels awful, scale back and consult your tracker notes with your clinician.
Realistic markers of progress. Detecting a faint note you didn't notice before, a small increase in pleasantness score, or the ability to taste one element of the soup more clearly. Those are wins. And compassion. Setbacks are normal. Progress isn't linear. If after 2 to 3 months you see no measurable improvement or you have concerning symptoms, seek specialty referral. Use the exact tracker entries to show what you tried and when. That speeds up diagnostic steps.
Before we wrap, a few final practical tips. Print the aroma cards and 14-day tracker from our show notes, label jars clearly, do patch tests for allergies, and never use strong medicinal fragrances or medicinal inhalants with clinician clearance. And for listeners with kids or pregnancy, follow Lena's substitution notes and check with your provider if you're unsure.
We want to leave you feeling capable. Start small, 10 seconds at a time. Try day 1 of the plan today. If you can, take a quick photo of your aroma jars or record a short voice note about your first sniff and tag @EarthyRemedy. We'll share community stories and put printable materials in the show notes.
Thank you, Dr. Maya and Lena, for practical, safe steps. And to our listeners, this is about reacquainting your senses with food and memory. Small, steady practices can shift perception over time.
Thank you for having me. Be gentle with yourself, document clearly, and reach out to clinical care if you hit any red flags. You don't have to navigate this alone. And if you try the soup, let me know what modifications you made. Make it your own. Small changes are part of the healing path.
That's our 2-week kitchen micro trial. Download the aroma cards and the 14-day tracker in the show notes. Try day 1 and tag @EarthyRemedy with your photo or a short voice note. We'll be listening and sharing community stories. Listen to your body. Trust the earth. Feel the difference.